wanted to speak about our booster campaign across BC and indeed our vaccination campaign, which has delivered, as you know, one of the highest degrees of vaccination in the world for first and second doses. And our effort for children 5 to 11 has now reached, I think, as of today's numbers are about 107,000 children 5 to 11 have been immunized as well, and focus today on booster doses. And I want to take you through where we are and some of the increases we'll be announcing in the number of booster doses given in BC, administered in BC in the coming days and weeks and months. We announced booster doses for all people in BC, 18 and over, on October 26th. And sometimes I see comparison between one province and another. We announced that everyone 18 and over at that time on October 26th would receive a booster dose. And that is what's happening. To date, this is as of Sunday night, 727,761 booster or third doses have been administered. We're currently operating at a capacity 35% higher than was previously announced, was announced on October 26th, as we've brought in and are rapidly advancing our pharmacy and health authority clinics. 67% of people aged 70 and above have already received their booster doses, 2 and 3, and that number obviously is growing significantly. And more than half of people over 65 have already received their booster doses, not announced, administered in arms. Approximately 65,000 healthcare workers have received their booster, and 125,000 clinically vulnerable British Columbians have received their third doses, their booster doses as of Sunday. And this is a program which will pay dividends for their health and for the healthcare system in the months to come. It was absolutely right to do, and it's based on our risk-based rollout that has shown its results in the first and second dose immunization. I just want to make this point about it because our immunization rollout continues to be based on risk, with priority given, as we said, to the clinically extremely vulnerable, to long-term care, and we've seen its positive impact there, to seniors, to Indigenous adults, to healthcare workers, and to those who have received 2 doses of AstraZeneca. And this age-based rollout will continue at an accelerated pace with invites sent out when appointments can be guaranteed. What we do in British Columbia is we have a gated system week to week where we send out invitations based on the number of available appointments. And so we go through category by category. So we're not offering appointments to more people in February. We're going week to week to offer appointments based on people's risks. So we're not having people with less risk competing with people with more risk. We're going through age categories systematically, and that's what you're seeing in our rollout, just as you did with first and second doses. So on the left is what's happened up to now, which is that we increased capacity by 35% over the plan we put in place on October 26th. The priority groups are as have been named. The total that was projected for January was 730,000 boosters, and that the booster program would originally, we said end of May, but now with the 35% would be completed by end of April. We are adding to that as of today. And the augmentation, which will start in the coming weeks, and then in January, we'll see an increase in vaccination capacity by 62% overall through health authority clinic expansion. In addition, pharmacy capacity will increase throughout January as the ramp up there continues. The increase in capacity will allow an accelerated booster program and ensure wait times remain reasonable. We won't be offering them to everyone all at once. We're going to go through age category by age category based on risk, based on the medical evidence that supports this program. And you'll see in the next slide the difference in January between what we were planning to do and what we will be doing. A very significant increase week to week in immunizations, capping off at around 320,000, I believe, in the week ending January the 30th. So you see the difference and the significant increase in vaccinations week to week. What have we done to put Scenario 2 in place? Vancouver Coastal Health has secured the Vancouver Convention Centre, and that represents a potential capacity of 130,000 shots in January with a startup of January 5th. And this capacity will serve the entire Metro Vancouver area Fraser Health has also secured the Guildford site in Surrey, and others will come in Fraser Health. Vancouver Island is securing mass vaccination sites, as is IHA, and Northern Health will be securing partners to deliver a mobile clinic strategy throughout smaller communities in the north. And we're obviously going to be, again, working with many of the community partners that have made our vaccination campaign so successful. Just to put in context what's required to put the Vancouver Convention Centre in place for 6,000 vaccinations a day, it requires 130 immunizers working 12-hour shifts and about 100 non-clinical staff. And that work is happening right now. And so that's the circumstances. You can see a very substantial increase in the number of booster doses for everyone, a continuation of our approach, which is to focus on those who are most at risk first and to move our way down age categories in order to meet that test.